Welcome to 72 Dragons Health. Today, we had the pleasure of speaking with John William Patton. Unfortunately, Dr. Anya Karavanov was not able to join us today. Welcome to this interview, John William Patton. It is an honor and a pleasure to have you with us today.
Thank you so much. I look forward to our conversation.
Great. John William Patton is a seasoned strategic leader with over 25 years of experience in mass media, public relations, entrepreneurship, and public health initiatives. Currently serving as the Vice President of the Center for Partnerships and Innovation at the National Association of Chronic Disease Directors. He takes initiatives to foster collaborations and innovative strategies to control chronic diseases. His contributions include spearheading multiple CDC grants and national health campaigns and leveraging partnerships with influential entities like the Ad Council, major television networks, and tech giants to create award-winning disease awareness initiatives. Dr. Anya Karavanov was not able to join us. However, she's the architect behind the campaigns Bring Your Brave and helping people live their healthiest lives, film productions that show the power of personal stories. Her role at the National Association of Chronic Disease Directors involves collaborating with the CDC's Division of Cancer Prevention and Control for the Screen Out Cancer initiative. My name is Dr. Pietro Aparicio from 72 Dragons Health. Thank you for joining us and for sharing your experiences with us. Without any further ado, let's begin. John, can you share about the National Association of Chronic Disease Directors' work and its vision in the field of chronic disease?
Sure. The National Association of Chronic Disease Directors is a very unique and powerful organization that spans the entire breadth of the United States, both in the state health departments, but also in our U.S. territories. We work with members who are working every day to prevent chronic diseases such as diabetes, heart disease, stroke, arthritis, etc. And we are kind of a conduit between the Centers for Disease Control and Prevention and other federal agencies that want to help prevent these chronic diseases. They work with us to then reach these state members.
Great. Thank you for sharing. That's a monumental work you guys have on your hands. And now, your transition from Director of Communications to leading partnership and innovation efforts at the National Association of Chronic Disease Directors was significant. How has this shift allowed you to further the organization's mission?
This has been one of the most strategic moves in my career. So I spent many years in media and marketing and started with the National Association as their Director of Communications. But in that role, I had the envious opportunity to reach many, many partners that were doing the work of our various grants and initiatives. And it was through those partnerships that I began to ask questions about their interest in doing more to prevent chronic disease. And over time, our CEO reached out to me and said, I think you really need to transition to build these bridges with our partners. There's a lot more work to be done in that aspect. And as a result, small exaggeration. It's tens of millions of dollars we've been able to garner because these partners want to do great work and they're looking for partners that can actually extend their reach and go places that they're not currently working.
Thank you. Sounds like a very important switch in your career and for the organization. Now, Bring Your Brave portrays powerful personal stories regarding breast and ovarian cancer. Can you share the highlights of this film production that was showcased at the American Public Health Association Film Festival 2023 in Atlanta, Georgia? How do you believe these narratives can impact conversations and awareness around cancer and other chronic diseases?
I'm so glad that we're talking about this because I believe it is the most strategic way to reach people with health information. We've been talked at for many years from very smart people in the medical community and in the governmental community. But the thing that really hits home and that accesses our emotions are true stories. It's called narrative medicine these days, but we know it as storytelling. And when we have the opportunity to film people who are walking through their own journey of cancer detection in this case, genetic counseling in this case, things that some people are not even aware of, the hereditary impacts of cancer and mutations of genes, they have to hear from real people that are speaking their language. And these films, absolutely typify the power of film.
Wonderful. Yes, personal stories also had that powerful impact on other people. It's very personal. Now, moving to your book, Brainless Health, it addresses health improvement. What key message do you aim to convey to your readers through this work?
So because I've been in the public health space for almost 15 years, I realized that there were a lot of things that people could be doing very simply to improve their health. Health does not have to be difficult. Sometimes we make it difficult, but it doesn't have to be. It can be as simple as, brushing your teeth. We don't get up in the morning and wonder if we have time to brush our teeth or if it's going to be too difficult to do it. We just do it. And so Brainless Health is about simple health habits that we can build into our life that operate in the back of our brain without even thinking. And lo and behold, 5, 10, 20 years later, we're still doing these health habits, and the impact to our life is significant.
Thank you. I'm sure many of your readers are benefiting from your book. Now, could you also elaborate on the impact of initiatives like Your Health Beyond COVID.org and Conversations About Cancer.org?
These are two great examples of really cutting-edge programs that the Centers for Disease Control and Prevention funded us to work on during COVID in particular. So during COVID, the hospitals and health systems were busy taking care of COVID patients. And so many patients, many people with chronic conditions were not taking care of their chronic conditions, their diabetes. They weren't taking their insulin. They weren't going to the pharmacy. They weren't getting their breast cancer screenings because they were afraid to go to the health system or the health system was overrun. And so this campaign was really targeted to people with chronic conditions saying, hey, cancer doesn't wait for COVID to go away. Heart disease doesn't wait. You have to check your blood pressure. You have to stay in touch with your doctor, even if it's telehealth. And that was a very powerful campaign. An interesting thing, back to the film aspect, we went to spoken word artists in New York City. These are people that use a turn of phrase and poetry and 100-year-old art to speak very clear messages in a memorable way to their audience. And it stuck with people, and the campaign was greatly successful. The other mention you brought up was Conversations About Cancer.com. And that website is a powerful way for physicians and patients to practice difficult conversations. So I might go into my doctor and not feel comfortable. I don't know what he's going to say when I mention my health concerns. And so I can go to this website and actually practice that conversation. And similar for the physicians. There are many physicians who have great knowledge of medicine, but they're not always trained up on how to have difficult conversations. And this allows them to practice with a simulation, kind of an avatar character, if you will. It's a great site.
Great. Yeah, these productions really facilitate the message to patients and also the communications between healthcare providers and patients. So great work. Now, what future plans does the National Association of Chronic Disease Directors have for utilizing film or multimedia? Are there any film productions on the horizon?
There are a number of ideas that we have percolating, and we have many partners in the media field. And so we're pitching to them and collaborating with them. We're looking at a food production show, kind of a cooking show that will be aimed at people with prediabetes. That's 1 in 3 Americans right now have this condition that is just on the cusp of having full-blown diabetes. So a cooking show is in the works. In the past, what we've done is partnered with folks that have already created important films, and we amplify them. We went to schools of public health, to the campuses, and enlisted students to promote these films, and then had film screenings on the campus with panels of experts to speak to the film's topic after it was over, and it was wildly successful. So we want to make sure that the work that's out there is already, is being promoted and distributed as best as possible.
Great. A cooking show sounds very exciting and engaging. John, we are grateful to you and Dr. Anya Karavanov for your inspiring work through the National Association of Chronic Disease Directors by encouraging conversations on chronic disease prevention and promoting healthier life. Thank you.
Well, thank you so much for all you're doing. It's very, very appreciated. Take care.
Thank you.